Hello again, this is Dr. Jerry Cuomo. I'm here with the next segment on video number 2. This was the tooth number 9. It's the upper left central incisor. It's a permanent tooth. So today's exercise will include the buccal pit and also what we call now a class 4. We'll do the class 3 first, which is going to be on the mesial side here. And I'll show you how to place the box preparation as well as the dovetail, and then we'll extend it up and include the corner of the tooth to make it a class 4. So first things first, we're going to mark the lingual pit of tooth number 9. I apologize if I said buccal pit, but it is the lingual pit, and it is going to be also a triangle, but it's going to be an upside down triangle on this one. So again, you'll take your 699 burr and create the base of your triangle. I would say right about there. This is also called the cingulum area. Now you want to go in perpendicular to the tooth surface, and on these you don't want to go in too deep because on a very young patient the pulp chamber is pretty close to that area, so you have to go in, you have to know your anatomy. Older patients, certainly you'll be able to go a little deeper, and of course decay always dictates the prep itself. So now I'm going to go ahead and extend now the upside down portion. So you'll see me do another vertical cut there. I'll do another one in here. Again, I'm following this direction. Here's the surface of the tooth, and I'm 90 degrees to that with my burr. All right. Let's connect the dots. That's it. And there you have it. A lingual pit class 1 preparation for tooth number 9. I'll turn my motor off. Let's go right to the class 3. Now class 3 is decay that's in between the teeth, but it's on front teeth or anterior teeth. Okay, so posterior was class 2's for proximal decay. Here we are. Now let's pretend that there's decay like right in here, and we've got to go in and take that out. So we have to know two things. Number one, we've got to drop our box preparation. So we're going to again come in from this angle, and we'll create our box. Again, our box is going to be parallel with this lingual surface, so this box here, and then we call this the lingual wall. This is the incisal or facial wall here. You can see how this is starting to look like a box, but it's going in this direction. Different from the posterior box preparation, which was dropped more toward the gingival area. I kept parallel with the gingival, and that was the bicuspid. All right. Then what we're going to do is put a little dovetail. We're going to keep it, have the box go in past the marginal ridge, and then we're going to produce a little dovetail coming off of our pulpal floor, and we'll put that right above our lingual pit. Okay, so let's go ahead and again, my speed is on 4. I turn my suction on, and we're going to go ahead and prep this out. I'm going to go ahead and do the dovetail first. Let's do that, and then we'll drop our box to the next level. So let's do that. Again, you're right about that deep is good. And we'll drop it right about here. Same depth. Now you got to be committed to connecting those two. So just draw a little slot like that. Alright, now that's as far distal as your preparation's going to go. Now you've got to go in and create this box. So let's go and do the box preparation. You can drop it. I'll allow you to drop it any way you want to. You can drill into it, or you can just use the side of the burr. Now don't forget, we got to be about 3 millimeters. Just about 3 mils. And about the depth of the burr. There we are. And we'll just drop a little bit, one more if we can in between, or just go ahead and start to connect the two. Either way is fine. So when you're working in the mouth, you're actually prepping this way. This is just an instructional video on design. It's not to give you anything really realistically in the mouth. Learning design and envisioning the patterns in your mind first, I think, is very important. Okay, so there's my box preparation. And of course, there's my dovetail. So now I want to connect the two. So I want to stay to the same depth as my dovetail and just kind of bring it through this middle portion right in here. There we go. Alright, so you got a nice little key lock there. Now, I'm rounding corners. And as I'm doing that, I'm opening up the box. Now, as decay will dictate. But this is, you know, this is just practicing how to place a little retention. There we go. Alrighty. So in the mouth, you'll have a matrix band that will cover this area. It'll be right in between the teeth. So you can't see it from the facial side of this tooth, but from the lingual, you'll see. And then, you know, sometimes the patient has problems that extend and include the exact corner of the tooth. So, you know, I'm just giving you a rough idea how to place a key lock here. This key lock could be a little closer to the tooth. or dovetail, I should say. But the main thing is you want to see a nice lingual wall here, a nice incisal wall. You know, it's almost like you just turn the whole thing 45 degrees, you know, from the bicuspid. So then the box would be the area that you build up with your composite first, and then once that's done, it's just like a class 1. So that's the class 3 on tooth number 9. And when I come back, I'm going to teach you how to include a corner or an angle of a tooth, and that would be the class 4. Alright, this is Dr. Jerry Cuomo. We'll see you on the next clip. Take care.